webinar. From AMSA Indonesia with my partner Abel, and we will be the master of ceremony and moderators for today.
I'm absolutely I'm absolutely thrilled to welcome all of you, medical students joining us from all over the world. Kyrgyzstan, India, Pakistan, Philippines, Malaysia, Indonesia, Macau, Singapore, and many others. Welcome to our Global Health Interchapter Collaboration webinar, Medical Curriculums from Around the World. Joining us today are members from each AMSA of AMSA International, and of course, the lovely organizing committee for this training who have worked so hard to put this together for you.
Before we begin, let's watch a short promotional video from AMSA International. I would like to request everyone to turn off their camera to reduce the bandwidth for the video to be played smoothly.
The Asian Medical Students Association is a peak representative organization of medical students from numerous nations across the Asia-Pacific and beyond, with its physical secretariat set in Taichung, Taiwan. Founded in 1985, AMSA International has been a non-profit, non-governmental, dynamic organization led by a board of medical students across the globe, bringing together chapters with a directive vision: knowledge, action, and friendship. AMSA International has functioned to promote the interest and welfare of Asian medical students through our knowledge-rich academic subsidiary, our very own academic journal, a robust transcontinental exchange program, our biannual conferences EAMC and AMC, our global health subsidiary, and our quarterly published e-newsletter. Our subsidiaries set out to nurture humanitarian values and medical ethics through a myriad of strategic partnerships. Every year, AMSA International brings together over 500,000 medical students through our activities, cultivating a vibrant international melting pot of ideas and adversities. Our alumni club, known as AMSAC, connects our vast network of alumni, continuing to support them on their journey towards becoming the doctors of tomorrow. To find out more, please visit our website or follow us on our social media.
I hope you enjoyed the video. Please turn your cameras back on and let's begin with the program. For now, let me read the housekeeping rules for the session today. Number 1, please keep silent and muted when the speakers are delivering their material and unmute only when asked to. And number 2, please keep your camera on as much as possible. And number 3, make sure to have fun and interact with the event as much as possible. We will be starting with panel discussion and continue on focus group discussion in breakout rooms. For the highlight of the day, we will have a panel discussion regarding medical curriculums with our prestigious speakers. Maybe for the slide, we can continue on the agenda for today. Okay, thank you very much. After panel discussion, you might want to prepare your question now for the Q&A session, as this might be once a lifetime opportunity. Along with that, we will also deepen our understanding about today's topic and meet some new friends around the globe through the focus group discussion. Don't forget to rename yourself as name_AMSA chapter.
Okay, now we will proceed to our next agenda of the day. I would like to invite Andrea Valerie as our Internal Global Health Officer. To Andrea Valerie, the screen is yours.
Thank you so much, Abel. Thank you so much, Nyla. So hi, everyone. First and foremost, thank you all so much to every participant for becoming a part of our Global Health webinar today. I would like to extend my deepest gratitude to Sydney as our Director of Global Health, as well as to everyone in AMSA International for giving me the opportunity to be able to be a part of this GHIC, to be a part of this Global Health webinar. And thank you so much as well to each NDO-PGH for their invaluable participation. Thank you so much to Royan. Thank you so much to Shika. Thank you so much, Shruti, Margaret, and Azumi, as well as every other organizing committee who has become a part of our webinar today. And I would also like to thank our esteemed speakers as well for taking their time to become a part of our event. And I truly hope to every participant that through our event today, all of us are able to learn more about medical curriculums, meet new friends, and have the time of our lives. So thank you so much, everyone. And I truly hope that this event will become a great moment for all of us. Thank you.
Thank you so much, Andrea, for the amazing opening speech. And next, I would like to invite Sydney Chandra as our Director of Global Health. To Sydney, the screen is yours.
Thank you so much, MC. Greetings, people of tomorrow. Welcome to all participants from all chapters across AMSA International. First and foremost, I would also like to thank the Global Health Organizing Committee, especially Andrea, my General Global Health Officer, who has poured a lot of energy to this event. I would also like to thank all chapters in this inter-chapter collaboration. Thank you so much for choosing such an important topic. There's no good healthcare without good doctors, and there will be no good doctors without good medical education. I believe that this event is really crucial, especially because not only because it is a cornerstone of healthcare, but also because we will be focusing a lot on the medical perspective, on the medical students' perspective. So I'll here in this opportunity, I like to encourage all of you to be active in your breakout rooms. Do design the best medical curriculum, your ideal version of a medical curriculum. Hope to see a lot of the great insights, maybe from speakers or participants alike. Viva AMSA.
Thank you so much, Sydney, for your speech. So before going through our webinar today, I would like to introduce the moderators for today's session. So my name is Nala Falinka Almira from AMSA Chapter Indonesia as the Ambassador of Public Health for AMSA Indonesia in this tenure. Today, I am also being accompanied by my friend Abel. Would you like to introduce yourself?
Thank you, Naila, to our honorable speakers, and to everyone. Hello, nice to meet every one of you. My name is Bernadette Cristabel from AMSA Chapter Indonesia as the moderator for today's Global Health Interchapter Collaboration webinar. I am very delighted to hear valuable insights from our respected speakers.
So we'll be diving deeper into our panel discussion. Now, I would like to introduce our guest speakers for the day. First of all, we have Dr. Arfan Gustiawan Suwangto, which is a family medicine specialist in Indonesia and also a subspecialist in family-oriented medical care. He is a surveyor of medical and health sciences accreditation of the Ministry of Education, as well as the hospital accreditation surveyor of the Ministry of Health.
Next, there is Hadasa Silva. Hadasa was the National Director of Global Health of AMSA Macau for the tenure 2022 and 2023. And also, there is Yashwardan Jain. Yashwardan was the National Director of Global Health of AMSA Kyrgyzstan.
Last but not least, we have Dr. Zulkhairul Naim, who is a public health specialist and the head of Department of the Medical Education in the Faculty of Medicine and Health Sciences of University Malaysia Sabah. Let us welcome all of our speakers today. Hello, Dr. Arfan, Dr. Zulkhairul Naim, Yashwardan, and Hadasa. How are you guys doing? Are you guys excited for today's panel discussion?
Yeah, thanks for inviting us. Good luck for this webinar.
Thank you so much. It's our pleasure to have all of you in our panel discussion today. All right, maybe we can now start our discussion session regarding medical curriculums. I think I can start with the first question. So could you guys elaborate on your country's medical education system in terms of admission process, program structure, and residency training? Maybe we can start with Yashwardan.
Yeah, good morning, everyone. I hope you all are doing good. Myself, Yashwadhan Jain, and I'm the current VPCB for AMSA Kyrgyzstan and the ex-National Director of Public Health in AMSA Kyrgyzstan. So, first of all, if we talk about the admission process in Kyrgyzstan, first of all, the admission process in Kyrgyzstan involves a meticulous examination and evaluation of the child's like the academic achievements, which includes the performance in subjects like biology, chemistry, and physics. And moreover, if we talk about the criteria of different universities, we do conduct like interviews and some like aptitude assessments to assess the suitability of the student joining the institution, like whether he's suitable or not. And also the rigorous what is it, the selection procedure which goes in the medical system, it aims to ensure that the only most qualified and the motivated individuals are admitted to the medical school, which sees a high standard for the future healthcare workforce. So that's how basically on the assessment of the previous subjects done in the higher school of the students aims to promote to the medical school. So that's how the admission process in Kyrgyzstan goes.
I see. Thank you so much for your
Yeah.
answer, Yashvardhan. I think next we can hear our opinion from Hadassah.
Yeah, first of all, thank you so much for having me here. And I kind of have a sore throat, so if ever I lost my voice throughout the whole panel, I'm sorry about that. Just to give a brief talk about how it is here in Macau. So, just to say one line, we only have one medical school, and it's the first of the whole city. And in terms of the admission process, we have some certain criterias that are probably similar in other places as well. So like here in in where we are, they usually in high school, you can separate into an art stream or a science stream. So since if we're going to go to the medical path, you have to at least have studied chemistry, and there's a grade requirement on that. And of course, no signs of color blindness or color deficiency in your sight. And as well as one thing really important is that you need to have good written and communication skill in both English and Chinese. And the thing is, because our curriculum is mainly taught in English, however, as we're serving the mass and the population is mainly Cantonese speaking or Mandarin speaking. So these are some requirements. And the admission process, there's actually three ways. So for locals, we have this thing, we call it like a recommendation scheme, where like based on your grades in high school, you will get recommended by having a letter or whatnot. And then the other two, which is open to the mass, let it be local or a student from abroad who wish to study here in Macau, you can take the written exam, which is, we call it the JE or Joint Admission Exam. So these are the four main universities in Macau, and if you have a good grade on that, you can pass a certain criteria and you can move on to the next step, which is the interview. And lastly, we have direct. So for any students abroad as well, like if you take an IB, SAT, A level, so based on your grades, that's what's needed to enter our our school. And then of course, you're gonna submit a personal statement and then an interview, which is an MMI. Yeah, are we just mainly talking about the admission process right now? So I'll stop at that.
Okay, thank you very much, Hadassah. Now we have so much insights about medical curriculums in Macau. Maybe now we can start with Dr. Erfan to elaborate more about the Indonesian medical curriculum.
Yeah, thank you, Bernadette. So briefly, in Indonesia, we have two major kinds of tests for the admission if we want to enter medical school. The first one is that if we want to enter a state medical school, I mean medical school that owned by the government, then we should join the national examination. And then the second one is that if we want to enter the private university or private faculty, then we just should join their own test. I mean, each private university has their own test. But even the state university also has special program, the more expensive one for special students. I mean, they give more money to the state universities, and maybe they just have to pass with lower grades of tests. That's all from me. Yeah, just a brief summary. I think it's clear enough.
Yes, it is very clear.
Yeah.
So I believe there are like extensive process to get into the medical school in all countries all over the world. However, I think
Mhm.
would like to hear more regarding the residency training in Malaysia, maybe. I think we can hear Dr. Zulhairul Naim's opinion regarding the residency training in Malaysia.
Yeah, hi, good afternoon, everyone. Hope you can hear me. It's my pleasure to be here today. In terms of residency training in Malaysia, after the student completed their medical degree, graduates are required to undergo a residency training. We call it a housemanship training to become a fully qualified medical practitioner. The residency training program in Malaysia is known as the housemanship or internship program, which typically lasts for 2 years. In these 2 years, the doctors or the trainee will be rotate in 6 major posting, mainly in internal medicine, surgery, orthopedic, obstetric and gynecology, pediatric, and also family medicine or psychiatry or NS. During this period, newly graduated doctors are placed in hospital setting again, and then with different specialty and gain hands-on experience and supervised by the experienced specialist. Okay, upon completion of the housemanship, doctors may choose to pursue the further specialization through residency program in various specialty. And then, for example, in internal medicine, ONG, pediatric, orthopedic, public health. The specialization training program typically range from 4 to 6 years, depend on the chosen specialty. And then all the training program conducted in the local university are accredited by Malaysian Medical Council, MMC, and adhere to the established standard and guideline to ensure the quality and competency of the medical graduates. Overall, the medical education system in Malaysia emphasizes a holistic approach in the training medical professional, where it's combining very rigorous academic study with practical experience to prepare graduates for successful career in their healthcare. Yeah, I think that's it from me.
I see. Thank you so much for your answer. What about in Indonesia, Dr. Arfan? How is the residency training in Indonesia?
So yeah, so previously I just stated about medical faculty admission, but if you want to talk about residency, then it's quite different because all of the residency training are managed by medical college, and this is not this is very special. I mean, quite similar to other countries, but we call it as medical college or collegium. So collegium is the gathering of experts and lecturers from all university and faculties regarding that specialty. So they will set up the test nationally, and then also they will select the candidates to join the training, and also they will set up the curriculum, and then they also make the test, the final test. We call it as national board exam. And of course, the length of the study will be very different for each specialty. Previously, all of this collegium are managed under our medical association. But nowadays, based on our brand new regulations, I'm one of the makers of the regulations. So we've made it under Minister of Health. So Minister of Health is the highest commander of all specialties nowadays, because we think that previously the medical association is too powerful and it's quite hard for us to manage them. Sometimes they're against our national program, something like that. We know that even in Korea, they against Korea government program, right? I mean, including in British, also the residents, they quite often do some kind of strikes, something like that, because of low payment. Of course, we want to raise the payment for the residents, but I think strikes will be not the best choice. We should provide service to the people first. Yeah, that's all from me.
Thank you very much, Doctor. Now we want to hear more insights from Kyrgyzstan. For Yashwardhan, can you elaborate more about the residency training in your country?
Yes, sure. First of all, what the residency program includes, like the basic criteria of joining a residency, the residency program includes most probably, first of all, the student must be passed with the regular amount of years of the MBBS or the MD course, like the basic, the undergraduate part which we do in our country is basically either of 5 years and 5 years to 6 years. It depends on the individual universities, like what university which you are. Some has 5 year curriculum, some has 6 year curriculum. Mostly focus on the languages for a year, so that even this criteria is for the foreign students as well. And if you talk about the residency programs, it is after clearing the 5 year undergraduate programs, and the student can join the residency program after giving an like entrance exam for joining a particular field. And the particular fields includes all the clinical subjects like surgery, obs and gynae, internal medicine department, which has specific subdivisions like endocrinology, cardiology, and the other branches of that system. And also, like there are certain criteria which the students need to fulfill. Either he is a foreign graduate student or the local cricket student. So, and like the criteria include signature from the Ministry of Health, like you are a student and you have studied from this university and so on. And also, like before joining the residency program, we have an application form with all the merits, all the CV, like how well you have worked in the undergraduate days, and then later everything is screened, everything is properly judged, like not in the case of that judging, but mostly like how entire and how well you have performed in the entire undergraduate. It will give you a seat with a proper examination. Screening examination is done for a p- particular residency, and then the best will be selected depending upon the course they have selected. So that's how the entire PG or the residency program. And the PG program is around 2 to 3 years, depending on the specialty the individual is opting to. So that's how PG residency is fulfilled in Kyrgyzstan. Even foreign
Thank
medical graduates can apply for that.
Thank you very much, Yashwardhan, for the elaboration of residency training in Kyrgyzstan. There was like the application form and also the program duration. Now we would like to hear more insights from Macau. For Hadassah, can you tell us more about how residency training is done in your country?
Okay, so the way it works here in Macau is that after you graduate, you have your medical MD medical degree. Then if you want to work in Macau, let's say in the government hospital, you are and be a licensed doctor, you will have to take an exam. And after you get the exam, you have to train in the government hospital for about 1 or 1.5 year. And during that year, you'll rotate again all those main clinical subjects like medicine, surgery, and all that. So after that, you finish, you pass everything, then you will officially be registered as a licensed doctor here in Macau. And you can practice already as a GP. But if you want to reach further specialization as what you would consider like residency and so on, you will have to register in the Macau Academy of Medicine. And keep in mind, this Macau Academy of Medicine is just newly made like 2 years ago. So a lot of things are still not yet well, I'd say there's still a lot of room for improvement. And let's say you want to specialize in a certain topic, Like let's say you want to be an OB-GYN doctor, you will have to see if there's actually a need for an OB-GYN doctor, if there's any vacancy, and then you apply. So it's still there's a lot more to improve in that, but it's just based on the demand. And if there's a vacancy, you'll take the exam, then you'll do your training, then you'll be a specialist. So that's how it is in Macau.
Thank you very much, Hadassah, for the insights from Macau. Maybe that concludes all the differences in residency training in various countries. And moving on, now we would like to discuss about how is the medical education system adapting to meet the evolving needs of the healthcare system and emerging medical technologies such as telemedicine, precision medicine, and artificial intelligence. Maybe for the first country, I would like to hear from Dr. Zulkhairul Naim.
Okay, thank you very much. For that question, the medical education system in Malaysia is continuously evolving to meet the changing needs of the healthcare system and to integrate emerging medical technologies. For example, medical school in Malaysia are increasingly incorporating technology-enhanced learning method in their curriculum. This include use of online platform like what we have today, visual and also visual simulation tools and multimedia resources to supplement the traditional classroom teaching and enhance the engagement. In addition to that, many universities and med school in Malaysia has VR or AR technologies, and they utilize it to stimulate clinical scenarios. This will allow students to practice procedures and decision-making skill in safe and controlled environment, especially during COVID time where we cannot go to the hospital. Okay. In Malaysia also, we also practice telemedicine education and training, with this growing importance of telemedicine in healthcare deliveries. Medical school are integrating telemedicine education and training in their program. This include teaching medical students how to conduct a virtual consultation, for instance, and interpret remote diagnostic tests and manage patient from. This is gaining popularity, especially after COVID, I would say. And then collaboration with a telemedicine platform and healthcare institution provides to them more opportunity to experience, and this gives exposure to telehealth technologies. And then in addition to that, many medical schools in Malaysia are revising their curricula to include courses or module on emerging medical technologies such as precision medicine or AI. For example, there are topics that can be integrated into relevant disciplines such as genetic, pharmacology, and medical informatics. And I myself, I'm currently doing a competency skill on digital health among medical students in Malaysia. In addition to that, medical profession in Malaysia also are encouraged to engage in their lifelong learning through CPD program that address advance in medical technology and healthcare deliveries, I would say. And then by adapting all this medical education system to incorporate emerging medical technologies and evolving healthcare practice, Malaysian aims to produce competent and future-ready healthcare professionals who can leverage technologies to improve patient care, enhance accurate diagnosis, and also advance the medical career. I think that is my opinion on that.
I see. Thank you so much, Dr. Zulhairul Naim, for your elaboration regarding the integration of medical curriculum as well as the needs of adapting to technology such as telemedicine. And I've heard that you've done a lot of collaboration with companies that are doing telemedicine to further improve the quality of healthcare professionals in the future. I think we can also hear the opinion from Hadassah. How is the integration of medical school with the involvement of technologies in medical areas in your
So I think now that we're all living in a world after COVID, where a lot of things we're very much used to, like using Zoom and all these things. So obviously the school has adapted a lot during that time. And I think just like how Malaysia is, it's very much similarly here in our medical school, where we do have a lot of we have simulation lab and all these things to really engage the student and learn prior to actually seeing the patient. And as technology keep evolving, we have AI and all this stuff that our school, I can tell they really do a good job in terms of having up-to-date teaching, like during our hospital attachment, such as, let's say we're at a radiology placement, as AI is more and more using in different fields like radiology, we are exposed to that. So I think that they have done a good job in adapting in how the world is evolving.
All right, thank you so much for elaboration regarding the question. I think now we can hear Yash Vardhan's opinion. How does your country's medical system adapted to the technologies in this modern era?
Yes, yes, yes. First of all, if we talk about the like medical education adaptation in Kyrgyzstan, like Kyrgyzstan is a country which develops every year regarding the field of medicine and the health workforce for this general local people. So it involves a continuous review and updating of the curriculum to reflect the latest advancements in the healthcare and the medical technology by the health of ministry. And now the thing which is most probably included is like there are certain modules which are implicated in the health system of Kyrgyzstan, like telemedicine, then precision medicine, and also AI is being implemented. Like they're working on implementing AI as well, so that it reduces the human workload in the language of English, Russian, and Kyrgyz as well. And if we talk about the needs of the local people, the universities are equipped with simulation labs with proper guidelines to approach a patient, then making it easier for the foreign medical graduates as well who are not well versed with the language. So we have a doctor, like we have doctors who has a proper grip on the English as well. So as the course of the telemedicine, it is getting upgraded year by year. And also, if we talk about the various stakeholders and the other NGOs who are implementing their support in developing Kyrgyzstan, uh, the proper health approach for the people, including telemedicine and the uh, the precision medicine. So that's how it is developing more and more. And also we have partnerships with other healthcare institution, whether it's government, semi-government, or private. Also industry stakeholders are ready to invest in this, and they are facilitating the integration of the cutting edge technologies and practices into the medical education, so that the graduates as well as the other the local people are well prepared to meet the challenges of the modern healthcare delivery. So that is how the thing is working in like Kyrgyzstan right now.
I see. So we can conclude that Kyrgyzstan has adapted well to incorporating the
Yes.
use of technology to the medicine aspect of medical curriculums. What about in Indonesia,
Yes.
Dr. Arfan? How is Indonesia has been incorporating technologies into our medical curriculums?
Okay, we haven't adopted those brand new topics nationally yet. So all of the medical faculties must have same curriculum nationally. 80% of the curriculum must be the same. But the government led us to do creativity and uh, opt kinds of spatial topics like artificial intelligence, palliative care, whatever. So it will be 20% of the curriculum can be modified by each medical faculty. So in my university, we have started to discuss about those new topics as our local curriculum, for sure. But based on my experience, I ever joined scholarship from Google as programmer. It was very hard to do, to learn about coding, something like that. I was taught by the IT students. Without her, I think that I couldn't pass the exam for the course by the Google. So I also ever set up startup, health tech startup. Of course, it's quite hard to learn from zero for us as medical doctors. So I think that for the next future, we just have to master how to use the technology. If you want to make that kind of technology, of course, it will take more time and also efforts. Quite different fields, you know. So I also member of Indonesian Health Tech Association and also member of Indonesian Artificial Intelligence Association. It's very hard to master that field with more details about technologies and then IT, something like that. And we have to get back to our knowledge regarding integral, something like that, basic mathematics. So it's very different field. And I think that in the next future, we just have to adopt how to use the technology. For example, regarding telemedicine, I ever joined courses from Harvard University in how to perform ethical medical service if we use telemedicine platforms. And then if we want to join online platforms, not only medical apps, I mean, on our phone, but also maybe this kind of platform such as WhatsApp or Zoom. Of course, we should know about how to perform ethically, how to differentiate emergency situation or not, when will we can when can we refer the patients to the hospitals, and also how to address emergency situation and how to direct the patients to do first treatment. The first emergency treatment. That's the most important thing based on my experience. Yeah. So not really how to measure the making of the coding, something like that is quite hard to measure. Yeah, maybe we should enter master study on something like that if we want to be very developed in mastering those technologies. Yeah, that's all from me.
All right, that sums up our speaker's opinion regarding how the medical education in each respective countries adapting to meet the evolving needs of the healthcare system. And we truly hope that the countries around the world can soon adapt more into technologies and the use of telemedicine, precision medicine, as well as AI in the medical curriculums. Therefore, we can produce more professional healthcare medical professionals later on, which will adapt well to the emerging needs of healthcare and technologies. And I think we can proceed to our next question. Our third question for our discussion today is, how does the National Medical Education System ensure standardized quality across all medical schools, considering that there are potential variations in resources and faculty's expertise? I think we can hear opinion from Hadassah first.
I was hoping you would ask me first because my answer for this question is very simple. We are the only medical school, so I guess we sort of are the standard, and there's no need to standardize across other schools. So that concludes my answer for this question.
All right, so it's very simple, yeah, for Macau, since there are only like a single medical school. So how to obtain the standardized quality is very much will be simplified. I think we can move on to Dr. Irfan. How is it in Indonesia?
Yeah, in Indonesia, we have national exam for medical students and also national board exam for medical residents. So the national exam for the medical students are managed. Are managed by the government, especially the Ministry of Education, and we're trying to develop programs and then also how to what do we call it? How to make a good questions, especially multiple choice questions, to read off from biases, and also how to make a very good questions, a very clear question for the participants. I mean the exam participants, and then we adopt system from the Singapore actually, and we have developed many modules, and also developed we have the questions banks to do that examination from all of the lecturers among medical faculties in Indonesia. So until now, I think that the 10% of the participants, they are still failed in their exam, so they have to retake the exam for the second chance. We cannot limit them. Some of them even have joined 27 times and still fail. And some of the national leaders make some protests about this, but we succeed to pertain this test because we do really need this test. Indonesia is country with the most largest number of medical faculties. We have 100 medical faculties nowadays, and we want to have maybe until 300 medical faculties in the next 10 years, because we're still lack of medical doctors in Indonesia. We just have 0.5 for 1,000 populations. So it's very, very low regarding WHO standards. So especially medical specialists, also we're very lack of medical specialists, and we aware of that because of the COVID, because of the pandemic. We are very lack of respiratory specialists, right? The lung specialists, doctors. So we have to add more doctors, not only basic medical doctors, but also medical specialists. Yeah.
Thank you very much, Dr. Erfan. As for Indonesia, it has a little bit different from Macau. For Macau, there is only one medical school, so maybe it is more easy to make a standardized in the country. As for Indonesia, it has around 100 medical faculties, and still the country is planned to expand due to lack of doctors in Indonesia. Dr. Erfan also mentioned that it is very low, the ratio doctor to population according to the World Health Organization standards. And now we would like to hear more from Malaysia. Maybe Dr. Zulkarul Naim, can you expand and elaborate more about the standardized system in medical schools in your country?
Okay, sure. In Malaysia, the Malaysian Medical Council, or MMC, is the regulatory body responsible for overseeing all medical education and practice in Malaysia. And it set a standard, and we have a standard for undergraduates and a medical program that all the medical school in Malaysia need to follow that guidelines. This to ensure that they adhere to the minimum requirement for the curriculum, and then in terms of faculty qualifications, the lecturers, facility, and also the education resources. The MMC accredited medical program offered by university based on their compliance. If you are not compliant, I'm sorry, you are not eligible for this, and then you need to meet at least the minimum standard. And then we also have the accreditation body that we call is Malaysian Qualification Agency, or MQA. So in order for you to work or to practice in Malaysia, you need to make sure that your university is accredited by MQA. And then MQA has a very extensive monitoring and evaluation in order to meet the standard, the international standard. Yeah, I would say. So yeah, I think that's about it. So we have, in essence, we have MMC, Malaysian Medical Council, and also Malaysian Qualification Agency, MQA. Yeah.
Okay, so for Malaysia, there are guidelines, also requirements and qualifications to make sure that medical students and also medical bodies has its own standards. Now, last but not least, from Kyrgyzstan, from Yashvardan, can you explain to us more about how it is done in your country?
Yes, yes, yes. As I can see you all regarding the standardized quality in Kyrgyzstan, the Ministry of Health focuses very much on the standardized quality given to the students and or the medical students. And what is that? Basically, when we are thinking to apply that, it requires certain collaborations between government agencies, academic institutions, and professional organizations. And how the basic like how basically this the quality standardized is first of all we have establishment of the like the accreditation standards of the specific university or the specific medical institution. Also, like there is a regular monitoring and evaluation of education programs, like are the systems up to date for the students or not, are the faculties up to date with the knowledge the ongoing newly diseases coming up, are they properly organized or not? Or the most for example, if I say about my university is International High School of Medicine. And if we talk about the teacher standardization there, every year I see many teachers of many different specialties or the subjects are going annually to the international conferences regarding the subjects of surgery, obstetric and gynecology, medicine, and everything, so that they are up to date with and well versed with the knowledge, which is the most important part right now. So they pass on the same thing to the medical students. So mostly the aim of the conferences is to make the teacher more more involved in that subject, so that the teacher should not miss out any information regarding that. And also, if I talk about the additional initiatives taken by the Ministry of Health in Kyrgyzstan, is to enhance infrastructure and resources, especially in the government medical colleges, like investments in simulation labs and the research facilities. Because in Kyrgyzstan, I personally feel that all the teachers and the faculties, in collaboration or with the help of the students, they conduct a lot of research programs, so that they are well versed or they are up to date with the medical field. And also, they all at last they all aim to contribute to raising the overall quality of the medical education across the country. So yes, they are trying their best to cope up with the like the scenarios and the like the practical aspects, obviously. So yes, so that's how the standardized quality. And also, in addition, if I talk about how the quality is assessed, we have every year annually accreditation system for all the universities, whether they're up to the mark or they are below the mark or they are not functioning at all. So every day the colleges are listed in the WHO, the other certain organizations where the medical colleges are ranked. So yes, we have an annual accreditation program as well. So this is how we standardize the quality of medical education.
Um, I'm sorry if I chime in, but I just briefly want to state something as well. So, given the question is asking how our national medical education system is standardized across, and we are the only school, so that is how I answer the question. However, if I go beyond that, and most of the doctors in Macau, actually all the doctors in Macau are not trained from Macau, since we don't even have our first batch of graduates yet. So the primary doctors that are working in Macau are mainly doctors that had studied either abroad and mainly in mainland China. So as I say, when we graduate, we have to take a test and then do an internship before being recognized as a general practitioner. So I think in a way, although we don't have a competitor within the city to compare both medical curriculum, we are in a way competing with these schools that have hundreds of years of teaching. And of course, the system will be more comprehensive. So I just wanted to point that out and say that, of course, there are variation, but we are trying to make it more catered to Macau and catered to the population in terms of our education. So that's all I have to say.
Thank you very much, Hadasa, for your elaboration more about how it is done in Macau. Then the doctors also brought to mainland China to perform. Okay, so maybe from all the country, this sums up about how government take part and also take a role in ensuring the standardized quality across all medical schools in the country, and also how there is national exams and guidelines and requirements that the medical students must fulfill in order to pass the exams and be a doctor. For the next question, we'll be discussing about how is the accreditation of medical schools graded? Are there certain thresholds that determine its grade quantitatively? Maybe for this question, we can start with Indonesia, Dr. Irfan.
Yeah, thank you. So I'm also one of the accreditors for all health-related faculties in Indonesia. So based on our experience, we classify them as three classes. So class A, B, and C. The A is the highest grade for for that faculty. So they can give some kind of supervision to the grade B and grade C faculty. And then they can also open up medical specialty if they have already got A grade accreditation. And what about B and C? B is the minimum accreditation actually, and C is the accreditation for the first year. If we want to set up a new faculty, then it will directly get C accreditation, C grade C accreditation, and after that, they should enhance their accreditation grades after 2 years to be at least B. And then in the next future, maybe next year, there will be only one classification, accredited and non-accredited. So the government wants to make it more simple. So not A, B, C anymore, but only accredited and non-accredited. Yeah. That's all from me, maybe. It's clear enough.
Thank you very much, Dr. Irfan.
Yeah,
As for
okay.
Indonesia, the medical schools are graded with A, B, and C, and doctor itself is the accreditor. So it is very lucky for us to have you here discussing about this topic. And moving on to Yashvardan, can you elaborate about the accreditation in
maybe for
Kyrgyzstan?
Yes, I may start. Like, did anyone say something? Because I heard one more voice.
no. Yes.
Okay,
Just
okay,
start
okay,
with your first.
okay, great.
I have problems with
Okay,
my connection.
okay, no problem. Okay. Now, if you talk about the accreditation grading, like basically what is accreditation in Kyrgyzstan? First of all, accreditation of a medical school in Kyrgyzstan, it involves what we say, it involves a comprehensive evaluation of various criteria, either for the universities, either for the teachers, either for the departments of the certain medical school. For example, we evaluate a lot of criteria like faculty qualifications, curriculum content, student outcomes, and like institutional resources. And also, there may not be explicit, like what we say, there may not be exclusive or the explicit quantitative thresholds for accreditation, but schools are assessed based on the compliance with the established standards and their ability to demonstrate the continuous improvement in the university. We know that all the universities, they try to work very hard so that their college does the best only for the medical students, but also the accreditation grades serve as indicators of institutional quality and are taken into account by the regulatory bodies which are from the Ministry of Health of Kyrgyzstan the employers and the students when making like decisions related to medical education and practices. And if we dive deep into the accreditation program, like how does it goes? Basically, a set of commissioners come from the Ministry of Health, and they mostly focus on the how does a college doing, like what kind of curriculum it is following, whether all the classes are taken properly or not, all this or whether the students are properly getting the clinical exposure or not. Actually, if we talk about the clinical exposure, if in future, if it like if the question is, I'll elaborate more, but these are the certain small points which the university looks for. And especially we know in corona time, it was like when we had the pandemic hit. At that time, the education system was turned online. So now the accreditation programs also show that is the online program still continuing or not. So these are the certain parameters which are looked upon. Even the teachers, like the teachers, what we say, like the qualification of the teachers is most important. Like the teacher should be a general practicing physician. He or she should have an experience in the wards and the OPDs, so that and also fluency in the speaking of English, as well as like obviously as a local language yourself. But for the foreign students, we need a certain criteria for the English language as well, so that they are at par with the language with the foreign medical graduate who speaks solely English. So that's how the accreditation grading is done. And with upon the accreditation grading, the universities are listed upon the A, the B, and the C listed, same like the other the other countries have. So that's how the accreditation grading works here.
Oh, I see. So there are some parameters for the accreditation grading in terms of the medical school grading in your country. And there are the highlight that I got is that there has to be the qualifications of the teachers, yeah, and their fluency in English. Therefore, it will add to the accreditation of the medical school. Now, I think we can go on with Dr. Zulhairul Naim.
Hi, in terms of accreditation for medical school, in Malaysia is more or less the same with Kyrgyzstan. We have like regulatory body, which is Malaysian Qualification Agency. They will come and visit us. They will see our curriculum, of course, our student and our facility, and also our lecturer. It's more or less the same with Kyrgyzstan. However, in terms of grading, they will give us in terms of years. The highest is 5 years. Like in University Malaysia Sabah, we receive 5 years accreditation. That's been the highest one. So that is the I would say quite kind of excellent. So after 5 years, they will come back to UMS and they will do another visit. So the accreditation is based on the number of years. I would say the lowest will be like 2 years. That's mean you need to do a lot of improvement in terms of your curriculum structure, your facility, and whatnot. And then after 2 years, you need to improve, and then they will review back your medical curriculum. If you not meet the standard, I would say you will have like a problem to continue the MD, the medical program. So yeah, that's about it in terms of accreditation.
All right, so I think this is very unique from Malaysia that you guys have the accreditation system in years, and it's like a class based on the years of the accreditation, and then they'll have to review it again and see whether the university, the prospective university, can achieve that threshold for the accreditation system. I think we can hear from Hadassah. How's the system in your country?
To answer this question, I don't think I can, since again, like I'm probably sounding like a broken record now, but we are the only medical school. So there isn't a way to technically determine your question.
All right, that's totally fine. And I think you can just go on to our next question. So, are there any both state-owned or public and private-owned medical schools in your country? If so, are there any differences in public perception as well as the quality? What about in Malaysia?
I would say it's very difficult question to answer, but again, every med school in Malaysia need to follow um, the standard that has been regulated by Malaysian Medical Council. So you need to achieve at least the minimum standard. So that's it. So in terms of perception, of course, a lot of people say like government med school is better than private, but I would say every med school in Malaysia need to fulfill the standard of the medical curriculum. So that's only my best answer for that. Yeah. I think you are muted.
Oh my God, sorry. So I guess the medical schools in Malaysia are mainly standardized, so there are
Yeah.
no significant difference in the public perception as well as the quality in all medical schools, right?
Yeah.
All right, thank you so much for your answer. And now I would like to hear from Dr. Erfan, as I myself, a medical student in Indonesia, know that there are a lot of difference in the public's perception as well as opinion regarding the state-owned and private-owned medical schools. How is it in Indonesia, doctor?
Yeah, so in Indonesia, state university is still having, they are still having better profile than the private university. That is because the state university, they can open up medical specialty program. So previously, medical associations against private university to open medical specialties. And that's, of course, that is a discrimination, right? So the government decrease the power of the medical association nowadays, and the government has taken up that power. And nowadays, all of the private university can open medical specialties, and we have started to open medical specialty in private university in Indonesia. For example, Pelita Harapan University, they have opened up a radiology specialty program and also family medicine specialty program. But actually, it becomes better now because of the national exam. So the national exam makes the private and also the public university become at the same level, right? Previously, before Indonesia has national exam for medical students, the private university has to send their students to be examined by the lecturers in state university. So the medical students in state university many years ago, they didn't have to join the national exam. Only medical students from private university must join the national exam. But nowadays, all of the medical students, both private and also public university, must join the national exam. And it becomes, of course, it becomes more better nowadays because even the private university can open medical specialty. And I think that the image of the private universities in Indonesia are becoming better. Yeah.
All right, so we can see that over the years, the gap between the private and state universities of medical school in Indonesia, can be clearly seen. However, from Dr. Irvan's explanation, we can see that it has very much improved in the few years. All right, so that's from Indonesia. What about from Yashvardan? How is it in your country?
Okay, so now this question is like public versus private medical colleges. Okay, so the basic difference in both the types of university or both the categories of university is very simple in our country. First of all, irrespective of the private or the public medical schools, the major aim of both of these medical school is to have a proper complementary roles in the medical education landscape. The major thing is that whether the university is either public or private, it matters a lot, but for this thing, like the part of the medical education, it doesn't matter. Now, the only basic difference which all the medical schools have, for example, if I'm talking about the public medical health school. So basically, public medical health school is a part of the government. So the public institutions often benefit from government funding and support, which allows them to offer robust academic programs and research opportunities. Like the proper support is there from the government in the public medical schools. But on the other hand, if I talk about the private schools, maybe the funding is not that great from the government, but yes, something is there. And the private universities, it's my personal opinion that they provide greater flexibility to the students and innovation in curriculum design, and also the delivery of the curriculum design. Like it's not that harsh or that strict than the governmental schools. Also, even though it is a saying that the the government schools are much bigger landscape, but I feel my private university is much has a more bigger uh, the what we say most bigger ambience, or the most bigger classes, or the most innovative, or this smaller class sizes. So that's how we mostly compare about that thing. And also, if there's a private medical school, we have a proper and the well equipped classes with all the digital technologies and more personalized attention to the students. But at the last, what we say, like both the institutions contribute to the diversity for the medical education in Kyrgyzstan, which offers a student a range of good options to pursue their academic and professional goals. And if I talk about the most important thing, the most important thing is that we have local students as well as foreign medical graduates in in both the types of university. So yes, it is globally well diverse. So that's the basic difference between the public and the medical school and the private medical schools.
All right, thank you so much for your elaboration. I think I would also like to ask Hadassah regarding this one. I know that maybe you're like the only medical school in Macau, but how's public opinion or maybe the perception regarding this matter?
So just to briefly state, so our school is technically a private school since the university itself is a private university and we are in that school. However, in my opinion, I think there's no much difference because although we are in a private university, our faculty is sort of like special because we do still get subsidies from the government, and like our tuition, there is a significant cut for local students. So we do have that support. So we're kind of, I'd say, in an in-between area of being private and public as well. And I think as for the public perception, I think it's still a little hard to say. I would say maybe wait until we have our first batch of students that have graduated. And I think that's what most people are anticipating to see. Okay, how's locally trained doctors like compared to the more students that more doctors that are actually trained in top tier universities like in mainland China, just to see the comparison. I think that's what they're mostly anticipating. Yeah.
Well, thank you very much, Hadasa, for your elaboration on this discussion. Maybe if we can move on to the next topic. And for this topic, I will be asking like, what does testing look like in your country? Is it in the form of multiple choice questions or essays? And maybe is there a reason behind the mode of questions that is picked? Maybe we can start from Malaysia for Dr. Zulkhairul Naim.
Yeah, I hope you still can hear me. So in Malaysia, in the context of medical education in Malaysia, can you hear me? Hello, can you hear me?
Yes, yes.
Okay. In the context of medical education in Malaysia, we use a Miller pyramid to design and implement a comprehensive assessment system where we can evaluate the competence of medical students across different level of proficiency. So with that sense, by incorporating a variety of assessment method at each level of pyramid, medical students need to have a necessary knowledge, skill, and attitude. For example, if you look at this, the bottom part of the Miller pyramid is about nose, the level where we assess the basic knowledge. So in that level, we have MCQs, mainly for preclinical, we have like one choice answer, OCA, and then for the clinical years, we have one best answer, or one single okay, one best answer, OBA. I'm sorry for that. For the know-hows, we want to assess the application of knowledge, where we have like OSCEs, clinical skill assessment, and simulation-based assessment. And then in terms of shows how to assess the demonstration of competency in performing tasks, we have like mini CX, mini clinical evaluation exercise, case-based discussion, or in certain med school, they also implement DOPS, which is that direct observation of procedural skill. And of course, in clinical years, we implement DAS level to assess the student ability to perform independently and effectively in the real work practice, where we implement workplace-based assessment. For example, long case, short case. Yeah. I think that's about it on the assessment.
Okay, thank you very much. So, as in Malaysia, for preclinical students, the method are using MCQs and also OCA, but in clinical years, the students must answer with one best answer, and there are also many other testing methods such as OSCEs and simulation-based assessment, case-based discussion. It is very interesting. And for now, can I hear from Dr. Irfan how testing look like in your country in Indonesia?
Yeah, just like Dr. Julkar Harun Naim said that we have many methods in our examination, especially it depends on the university or faculty, right? But regarding in terms of our national exam, of course, I have stated before that we have multiple choice questions, and also after the few days, we the students, the students will get the OSCE exam, national OSCE exam. Yeah, that's all for me.
Okay, thank you
Yeah.
very much, Dr. Irfan. So in Indonesia, it is pretty much similar to other countries as well. It uses MCQs and also depends on the Faculty of Medicine in each university. Now moving on to Kyrgyzstan, can I hear more about the testing method in your country for Yash Fardan?
Yes, yes, yes. Now the major question is about the assessment and the testing methods, right? So first of all, like testing methods includes in our country from every aspect, starting from the MCQ, starting from the long essays, starting from the mid essays, starting from the all the clinical assessments. Like I'll briefly say about everything. For example, if a university is having a 5-year program, like my university is a 5-year program. So if starting from the first, like we have 2 semesters in each year, so total we have 10 semesters. So the batch which is graduating in the 10th semester, we have like as a graduation exam in that part, in the 5th year part, is like from only the 10th semester, we have 3 governmental exams. Like 3 government exams include the OSCE, the GOS, and the HOK, which is History of Kyrgyzstan. Like you need to pass all these 3 subjects in order to clear your undergraduate degree, starting from the like whatever the hard efforts which you gave in the first to ninth semester from the first year itself, that all thing will be tested upon in this part. And yes, we have certain stations as well for the OSCEs and everything. Also, the GHOST exam is under the entire government officials and so on. But if I start from the starting year, like from the first year, like the first semester, from first semester till the ninth semester, we have certain subjects, we have certain departments, we have certain limitations. For example, the first 2 years will be preclinical, and then starting third year it will be clinical. So in order to pass a semester, in order to pass the class activities, we have divided into lecture classes and practical classes. So in practical classes, we need to clear the topic wise, like we have a generalized thematic plan as followed. So in every class we have a certain topic which we need to discuss. Now it depends upon the faculties, obviously, like how the teacher wants to conduct or how the faculty wants to conduct the exam. Few teachers after certain units, for example, if we have two topics and then one unit, so the mostly, if we call about that unit, the unit we call it as a module. So that module is basically upon the teacher, how the teacher wants to conduct. Either it can be MCQ form, either it can be a theoretical form, or it can be a mix of both these things. So till the 9 semesters, this all things goes. And the final exam of each semester, like to get a promotion from one semester to another, we have a generalized 100 MCQs test for all the students in our college, so that they get promoted to the next semester, for example, from fourth semester to fifth semester, in that particular way. So that's how the assessment goes on. And literally the teachers who take this oral assessments, basically, sometimes it's very hard, sometimes it's medium, but yes, according to, like, as we gradually grow, we get habituated to that. So yes, so that's how the testing assessment is done in Kyrgyzstan.
All right, thank you so much, Ashwardan, for your elaboration. And I think it is a very extensive process of assessment in medical schools in Kyrgyzstan. There are like MCQs, clinical assessment, which are there's not a huge difference from other countries, but there are the three governmental exams that has to be passed to get the undergraduate degree. And I from your information, I get that the assessment also depends on the faculty and the lecturers to conduct the exams itself. All right, thank you so much for your amazing elaboration on that term. What about in Macau, Hasdasa?
Thank you. So in Macau, we basically the main form of test is, as a lot of you as well, like multiple choices, and we have short answer questions and OSCEs. And the testing is basically, since our program is by system blocks. So after you finish each system, like let it be cardiovascular, then you'll have to take a test to move on to the next, and so on and so forth. And every end of the year, you'll have a summative and your OSCE, and that's pretty much how it goes. Yeah, just like that. Thank you.
All right, thank you so much, Hadasa, for your answer. So I think we can conclude that mostly the exam type in countries all over the world for medical school are the same, like MCQs, short answer, and then OSCE, and maybe there are some other who are following those main exams, but the gist is pretty much the same. All right, thank you so much for your answers. And I think we can move on to our next question is how is clinical exposure incorporated into your curriculum? I think we can start with Yashvardan first. How is it in Kyrgyzstan?
Okay, so basically, how the clinical exposure is in Kyrgyzstan is basically started from the first year itself, like not a proper OPD ward or like that. Now, the basic clinical exposure starts from the first semester itself. For example, a student will be having a proper, what they say, like a proper 2 weeks of clinical training every semester, so that till they reach to their mostly the clinical years, for example, third year, so that they get incorporated with the proper basics of the clinical exposure, like what is taught. For example, if I to be specific, if I say about the first semester, they in the clinical training week they are taught to they taught basically how to do an injection, how to do a proper catheterization on the dummies, obviously. So the knowledge starts from the preclinical segment only, but it takes further further strike in the future. And also, if we talk about the clinical exposure, mostly in the certain clinical departments like internal medicine department, which has a cardiology section, also the obs and gynae and surgery. After the class, like after the classes which we have, if the surgeon or the teachers they are free, they'll say us to just just wear your scrub suits and just go to the OT. So like that's how we get exposure to all the surgeries and the major the major concept for the clinical exposure. And also it teaches us mostly as even I am a foreign graduate of this country, so yes, we do have a bit communication lag, but the actual local students who are part of that thing, they have a proper clinical training with the proper patient interaction, and also a proper development of the clinical reasoning, because the most important thing while the clinical exposure is the language itself. So how well versed a student is with the language of the local population, the more he'll learn from the clinical exposure given by the university or by the faculties. So that's how. And also this all things including the rotations in the hospitals. Now I'm currently in the fourth year, right? So the junior years, like the first and second year, they are allotted with the night duties as well, like entire night they have to stay in the wards, so that they learn about the emergency condition if something like God forbid should not happen, but if something happens, so they are aware like how to they're learning like how to tackle with those situations. That's how it is. So like this is the base of the clinical exposure.
All right, I think it's very exciting to see that the medical students in Kyrgyzstan are very greatly exposed to the clinical exposure. That you guys have 2 weeks of clinical trainings in every semester, as well as the rotations, and I think it's very great to lead you guys and learn how to navigate those actual conditions when you were to be a doctor in the near future. Okay, what about in Indonesia, Dr. Arfan? How is the
Yeah,
medical?
yeah. May I share a slide about this? Maybe it's kind of screen share.
Yes, I think you can
Yeah,
share.
yeah. Okay. Uh, can you look at my slide?
I'm not able. Okay. Okay, I think it's visibly seen.
Yeah. Can you see it?
It's very clear.
Okay. Yeah. So in Indonesia, we have 4 years of bachelor's programs. It's full of theory, right? Sometimes, of course, we also have OSCE exam, but it's kind of simulated, right? So we just use simulated patients that we have trained before. So I think it's not really clinical exposure yet. And then after bachelor program, 4 years bachelor program, then the students should continue to medical doctors programs for about 2 years more, right? So in these 2 years, they will get some kind of entrance program in hospitals and also clinics and also primary government primary care facilities, something like that. So it's kind of clinical rotations. And then after that, they must join the national exam. So totally 6 years to get a medical doctor's degrees in Indonesia. And after that, they must have internship for 1 year. And after the internship for 1 year, then they can get their license. And if they want to continue to clinical specialist, of course, it depends on the specialty programs. I mean that maybe from 3 or until 6 years more educations. And after that, they can also join a subspecialty program for 2 years more or maybe even more, 3 or 4 years, depends on the subspecialties. That's the general profile of the Indonesian medical doctors education system. And if they want to enter the residency training, this is a example from our residency training in family medicine specialty. So you can see that in the first year, we just have theories such as research methodology, communication, evidence-based medicine, review our basic medical science and quality assurance, and also clinical skills. And after that, in the second years, we will have internship pace. It's kind of clinical rotations also. And after the third years, we will have complex case. We will be complex case coordinator and also supervisors for our junior residents. So we have 3 years program in our family medicine training. And then as you can see that in the third years, we can be sent by our lecturers or our teachers to rural areas. So we have got our, they trust us to do our own individual practice in rural areas, even though we're still residents. Yeah, that's all from me. Is it clear enough?
Yes.
Yeah, thank you. Yeah, okay, thank you.
Thank you so much for your explanation on how Indonesian medical students are exposed to clinical areas of the medical school. I think we can all hear from Malaysia. Dr. Zulhairul Naim, how is the medical students in Malaysia?
Okay, as we know that clinical exposure is an integral component of medical education in Malaysia that provides students with hands-on experience in the real-life healthcare setting. In Malaysia, like Kyrgyzstan, we also have early clinical exposure, or we call it as ECE. Many medical schools in Malaysia, they integrate early clinical exposure into the curriculum. This allowing students to interact with patients and healthcare professionals from early stage of their medical trainings. There are many activities that they conducted, for instance, a hospital visit, shadowing experience, and introductory clinical skill session that designed to familiarize students with the healthcare environment, clinical routine, and also patient care processes. In addition to that, we also have a clinical clerkship. In a clinical clerkship, are the structured rotation in various clinical specialty where the students spend dedicated period of time working alongside with healthcare teams in hospitals or clinic. In Malaysia, clerkship typically occur in year 3 onwards, and this provides students with opportunity to apply practical knowledge to the clinical practice and develop their clinical skill and participate in patient care under supervision. For this clerkship, they need to rotate in different medical disciplines such as internal medicine, surgery, peds, gynae, pediatric, psychiatry, family medicine. Okay. In addition to that, we also have bedside teaching and also walk around. Yeah, this normally conducted by clinical faculty members, which provide students direct patient contact and clinical learning experience. During this bedside teaching session, the student can interact with patient, take their medical history, perform physical examination, and also participate in clinical case discussion under guidance. Okay, and then we also have a simulated based training, which include the task trainer, simulated patient, and also high fidelity mannequin, which improve or with improved understanding of the medical student in the real clinical practice. And if you can see that by incorporating the diverse clinical exposure opportunity throughout the curriculum, medical school in Malaysia prepare students for the challenges and responsibility of the clinical practice, and also foster professional development and instill a patient-centered approach to healthcare deliveries. Yeah.
Okay, thank you so much for your explanation regarding this matter, Dr. Zulhairul Naim. So
Yep.
I think the medical students in Malaysia are also very well exposed to clinical, and they get firsthand hands-on experience and interacting with patients that will further establish their communication with their patient. And lastly, from Hadassah, how is the condition in Macau?
So I think we are very much exposed to clinical learning early on. So I can remember even in my first year, like let's say we've reached some certain topics, we will have a chance to go to the university hospital and just see it as it is. And also for the first 3 years, we are required every summer to do an elective where you are basically an observer, but many times the doctor that you're following or the institution that you're following, let it be a elderly home, they would let you to do some hands-on so you can gain some clinical exposure before your clerkship, which is we have a junior clerkship starting on our 3rd year and up until the 5th year. So I think our course is actually very much clinically based and we have a lot of clinical experience, which is I appreciate a lot because personally I feel like I learn more being in an environment rather than listen to the lectures. So that's my opinion.
All right, thank you so much. So that concludes our panelists' answers regarding the application of clinical in and the corporation of medical students. And I think it's really wonderful to see that from each of the country they have their own way to make the medical students understand the real condition in the hospital later on, but from elective programs and hands-on experiences, hospital visits, and there's a lot more programs in each universities that will help the medical students that to establish their own career later on. And that is the last question of our panel discussion. And I think Abel can continue with our Q&A session.
Thank you very much, Naila. Also, thank you very much for the speakers for the elaboration and also the explanation. And this panel discussion must come to an end. But before that, we're opening a Q&A session for the participants. So if you have any questions for our guest speaker, you may type your questions in the Zoom chat feature or raise your hand if you would like to voice out your question. Okay, maybe I can read the question that has been sent to the private message. If your country can adopt an aspect from the medical education system abroad, may it be from this panel or other countries, what would it be? Maybe we can start from Hadassah.
Thank you so much for that question. I think, of course, there are a lot of things to learn because given that we are still very new, but I think that I'd like to see a more comprehensive curriculum as we go on and so forth. Because based on my experience, like my batch and the batch below us, actually, there are some differences in the things we learn. They may be exposed to some things that I haven't learned yet, such as cadaver learning. During my batch, since it's illegal in Macau to have cadavers, we just tend to have emballed pieces, but the years below us, they have gone to like mainland China to take the classes. So I think maybe just a more comprehensive curriculum, and I'm glad that I get to hear about how other countries' medical curriculum is, and I hope that we can continue and be better from now.
Thank you very much. It is very interesting where about the illegal to have cadaver, and also you hope to have a more comprehensive curriculum in the future for medical students in Macau. As for Kyrgyzstan, can I hear your opinion for Yashvardhan?
Like, is the question regarding the cadavers thing? Because when the question was said, my network got some unstable, so I could not hear the question. If possible, if you can repeat it, it's a great thing.
The question is if your country can adopt another aspect medical education system abroad, what would it be?
Uh, yeah, if my medical university, if it would have adapt, basically, I would personally suggest to have a kind of what we say to have a first of all more practical knowledge, like more clinical exposure first of all, because that's what we foreign that's what we foreign medical graduates lack a bit, and also like in reducing the time constraint in between the lectures, like to have a proper like a proper schedule to the students. Like sometimes it's become too easy or sometimes it's become too hectic. So in order to normalize a proper thing, like a proper schedule to the students, like the schedule is proper but sometimes we feel it's too hectic. So if that is looked upon, then it's a great thing. And also about the cadaver, like about the cadaver thing, mostly since the start of the medical college, we have the access of the preserved cadavers, like they are mostly like in the preserved form. But as we know about the laws and everything, so even we can't do. But in the last semester, we have a subject called as forensic. So in that we do deal with the actual cadavers. So yes, and also if there would be certain change, the same regarding the importance of this certain like the more emphasis sometimes it's given on the non-medical subjects. So if that is reduced to and more priority is given to the medical subjects, like in the starting years, it would be much beneficial. That's what I think regarding the education in Kyrgyzstan. Like it would be better.
Very interesting. Yeah, thank you very much. It is very interesting. So you hope to have more practical knowledge.
Yeah.
As for Malaysia, can I hear your opinion for Dr.
Yeah, my hope and aspiration for the future medical curriculum in Malaysia, I really love to see integration of the technologies. So I hope to see the continued integration of technology into the medical curriculum, and then leveraging digital resources, simulation technology, and also a visual learning platform, which can enhance technology and learning experience. As we know that 20 years ago, the teaching method were different compared to now, and then we also need to include VR simulation, online interactive modules, and we also when we do online interactive module, we can not just focus in one university. We also can expand it, and we also can do telemedicine training to prepare our students for the digital age of healthcare deliveries. Okay, and in addition to that, I also hope that we have like more interdisciplinary education, because as you know, the interprofessional education is very important, where they bring together students not just from medicine, but from nursing, pharmacy, public health, and other discipline, where they can learn together and can learn together, which can promote holistic patient care and multidisciplinary problem solving. And then, of course, we hope that our medical curriculum in Malaysia emphasize on preventive medicine and public health as well, because as you all know that this knowledge and skill will address the underlying determinants of health and promote health equity. We also need to include, for example, lifestyle medicine, health promotion, and disease prevention strategy in the curriculum. And then my last hope is that we should not focus on the content, like we call it as a content centric, but it should be like the curriculum should be more on like personalized medical curriculum, like personalized medicine as well. Yeah, so that is my hope, and for the future medical curriculum in Malaysia.
Thank you very much, Doctor. It is very interesting as you mentioned how you wish in the future there will be more integration of technology in the medical curriculum. And I think it is also very important for us doctors to keep following the trend so we can always be adaptive to the current situation. And last but not least, for Dr. Erfan, can I hear more about your insights on this? Like, if Indonesia can adopt an aspect from medical education system abroad, what will it be?
Yeah, so that Indonesia was a colony of the Netherlands many years ago, right? So we follow the curriculum from the Netherlands. And recently, we have revised our health regulations, our health act, and I'm one of the initiator of that new regulations. So we want to adopt British style and also American style in the next future, especially hospital-based residency. You know that nowadays it is compulsory for the candidates, if they want to enter the residency training, then they must register themselves to the university. So the university open up the registration for the medical residency training. But in the next future, we want to adopt British style and also American style. So it's kind of hospital-based residency. So I think that it will add up much more. I mean, many more specialists in the next future because of that system. Because hospital-based system will ensure more trainees to join the program. It's still quite hard if we just register ourselves to university. You know that in university there is a limited number, right? For each specialty. For example, for even for special general specialty like internal medicine, maximum number for each university only can accept for maximum 15 participants each year, 15 until 25 participants. And what about surgery, such as neurosurgery? Only 3 until 6 participants for each university. And only 18 university are opening up medical specialty nowadays in Indonesia. And so in the next future, we hope that all private hospitals, I mean, qualified hospitals can open a medical residency training, not only university. So we will open 2 kinds of admissions for medical residency trainees. The first one, you can register yourself to university, and the second one, you can register yourself to the qualified hospitals, qualified academic hospitals.
All right, thank you so much, Dr. Irfan, for your explanation regarding that. And I think it's really amazing that each of the countries need to adopt an aspect from medical education system from all over the world. I think that through collaboration, this can occur in the near future, and each of the country will have their own comprehensive curriculum based on their needs of the countries. All right. I think that perfectly answers the question. And we have one more question here from Diki from AMSA Indonesia. He said that he's really interested in telemedicine despite the benefit that we experience from it, but we still found weaknesses. For example, misdiagnosed, lack of empathy, and many more problems. His question is, how does the medical curriculum in your country see this new trend, especially for developing countries? I think we can start from Dr. Erfan first.
Pardon me, is it about the trend?
Okay, I think I can repeat the question.
Yeah.
His question is how medical curriculum in your own respective countries see this trend, especially for developing country.
See this, what kind of trend? Can you explain it?
Okay, so the telemedicine and benefit that we got
okay.
is
Yeah. So as I stated before, that the 80% of the curriculum in Indonesia, it is national curriculum. So a university or a faculty must have that curriculum in their 80% of their curriculum because it is nationally regulated. But of course, we can develop our own curriculum in each faculty. So 20% of the curriculum can be very freely managed by each university. So of course, we have some universities who I mean that the staff of them have developed curriculum regarding the telemedicine, artificial intelligence, precision medicine, but not very many until now, because I think that those are new fields. Even in America, telemedicine is still being discussed by the experts whether they want to admit it as formal specialty or not. So I think that if developed countries have stated that telemedicine or artificial intelligence or precision medicine as formal specialty, then I think that the developing countries will follow. Yeah.
Okay, so since telemedicine is like a new area in the medical field, I think it's very much still discussed, and especially for developing countries, we're still seeing how like American and British go with this telemedicine and how it's going to be adapted in the medical field. Is that right, doctor?
Yeah.
Thank you so much. I think we can move on to Hadessa. What's your opinion regarding this one?
So as we all know, like telemedicine is, yeah, like Doctor have mentioned earlier, that it is new. And although personally I haven't been exposed much to telemedicine, I'm sure that my school has recognized the importance of it, and I hope that in the future they would somehow incorporate it to our curriculum so we could have some training on its principle. And also I think it's important as well to know the technical skills, because I think a lot of us, although we are very tech savvy, we're the tech savvy generation, there could be some parts that we can always learn more. And also to really, I think it's very different if you're speaking to someone through a screen and speaking to them face to face, such as like physical examination, you're not able to do. So I think it would be really interesting to see how it's incorporated in our curriculum to really know how to see the signs through a screen and so on. So yeah, I hope to see that we are going to further implement this in our education.
All right, thank you so much, Hadessa, for your elaboration. And I think we can hear the opinion from Yash Vardan.
Yes, if we talk about the specific thing regarding the telemedicine and in comparison with the developing countries, see, telemedicine personally, if I feel it's kind of, it's like a far distance communication with the doctor. And there are certain things which we need to keep in consideration, like properly saying our history to the doctor at that moment to get a to at least get a proper initial treatment for the same. And if we talk about like even our country, like Kyrgyzstan is kind of adjusting to it, because not everyone is available at one moment. For example, the people living in the most outskirts of the city. So in order to have the access for that, the major limiting factors with relation with the developing countries includes like the first of all the inadequate facilities, because in the outskirts and everything we have certain network issues and certain like certain calamities which happens during the telemedicine time. So yes, so this thing is the most uh, like most thinking thing which we need to sort at this moment. And not everyone is well versed with the like with the current technology which we have right now. For example, the use of telemedicine requires basic use of the smartphones or anything to have a proper. So few people may have that skills, few people may not have. So like getting it 100% accepted is still a taboo as of now, because as we progress in the life, as we progress in the terms of uh, like technology, we need certain time to adjust to that. So that's how a major drawback can be there in that part. And also if we talk about the efforts for the system, the efforts play a major role, like how well the person is trained to use telemedicine at that moment. Because the places where we don't have proper internet access, proper facilities for the same, so there may be a lacking. And as it was mentioned before, like the developed countries, how they incorporate things. So that's how we keep them an idol, and our country or any other country like takes it as a role model, and then they like they what we say, the proper word is like they properly incorporate that in the country. So yes, like everything takes time. So the most important thing I can say that patience. Like the more like everything will happen at its own time. Just we need a proper guidance for that. So that's what I'll try to say regarding that. And also, even if the government is ready to support in that thing, the things may become more easier than we expect. So, like this is how an entire nutshell of this.
Okay, thank you so much, Yashvaran, for your
Yeah.
collaboration regarding this matter. I think we can continue with Dr. Zulhairul Naim.
Yeah, as for me, telemedicine is speaking there's a lot of weaknesses of telemedicine recently. Despite this challenge, the strength of medicine in improving access to the care we cannot deny, enhancing convenience of the patient. A patient not from the rural area no need to come to the hospital frequently because we have a telemedicine facility, and this facilitating continuity of care and make it a valuable tool for expanding healthcare services and improving patient care. For instance, if like in the normal routine, the patient need to come like 10 times to the hospital for regular checkup. With telemedicine, it's not if you have telemedicine, maybe the patient can come only like 7 times, 6 times. And if patient have a serious problem, a red flag, patient need to see us, not using a telemedicine. Okay, and then that is important for us to addressing the weaknesses of telemedicine, and it's required ongoing effort to overcome the technology's barriers. We need to ensure the privacy and security, enhance patient-provider communication because sometimes the internet is not very good, and we also need to navigate regulatory and reimbursement challenge. So these are the way forward that we need to think, and then we need to make sure that we able to address all the weaknesses of telemedicine. Yeah, this is my notes on this.
All right, thank you so much, Dr. Zulhairul Naim, for your answer. I would also like to thank all of our speakers for today, Dr. Arfan, Dr. Zulhairul Naim, Yashwardan, and Hadassah for answering all of our questions in this Q&A session. Unfortunately, due to time constraints, we will have to end the Q&A session here. And thank you everyone for all of your wonderful and interesting questions that leads to a very impactful discussion for all of us.
But before we let you go, we would like to present an e-certificate to you as a token of appreciation. And we would like to also take a quick picture with all of the speakers.
Okay, I think we can start with Hadassah, and we'll have the help from our organizing committee to screenshot this picture of us. I think we can start with Hadassah first.
Wait, I will spotlight Hadassah. Okay, I'm going to take the picture in 3, 2, 1. Okay, thank you so much, Hadassah.
All right,
Thank you all.
thank you so much, Hadassah, for coming and sharing your thoughts in this discussion session. Next, we have Yashwardan. Okay, Andrea, can you help to pin Yashwardan? All right.
Okay, I will be taking the picture in 3, 2, 1. Okay, thank you so much, Yashvardan.
Thank you so much,
So much for
Andrea.
this opportunity.
Okay, we can continue with the next certificate is for Dr. Zulhairul Naim.
Okay, I will be taking the picture in 3, 2, 1. Thank you so much, doctor.
Thank you.
Thank you so much. And you can proceed to our last certificate for Dr. Arfan.
Okay, I will be taking the picture in 3, 2, 1. Thank you so much, Dr. Irfan.
You are very welcome.
Thank you so much, Dr. and Andrea, for the help. And once again, I would like to say thank you very much to all of our speakers for coming to our panel discussion session. And that marks the end of our panel discussion session.
Our next agenda will be focus group discussion in breakout rooms. You guys will have 40 minutes for the session and you'll be assigned to your breakout rooms soon by the organizing committee. Once again, I would like to represent all the participants to express my greatest gratitude for all the speakers for sharing their valuable insights from each country.